Hello, it's Dr. Rhonda Johnson, and today is Saturday, July 23rd, 2022, and today I'm giving my monkeypox update number 8. This is my 8th message on monkeypox. Now, let's start with a global outlook first. Today, the World Health Organization declared monkeypox as a public health emergency of international concern. Folks, this is the last step before declaring monkeypox to be a pandemic. Now, there are over 17,000 confirmed cases in 80 countries. Compare this to 1 month ago, where there were 3,400 cases on June 22nd. Now, the top 5 countries in the world with monkeypox cases are the United Kingdom, Spain, United States, Germany, and France. Now, the CDC and the World Health Organization say that 99% of the monkeypox cases outside of West Africa are in men who have sex with men in high-risk sexual behaviors, such as engaging in sex with multiple partners, sex parties, and saunas. Now, men who have sex with men who are not engaging in high-risk sexual behaviors are not at high risk. Now, I want to say that this is today's high-risk group, but not tomorrow. This disease can and will likely spread to other populations. In fact, anyone who has contact with an infected person or contaminated items can get it. So how do you get it? Again, through skin-to-skin contact, through respiratory droplets in close range, through sharing contaminated items. And there is a new preprint publication which shows that the virus may become airborne during specific activities, such as changing bed linens in rooms where infected people are, or in residential bathrooms. Now, this is new information from a preprint study. Now, to move to look at the U.S., there have been more than 2,800 confirmed cases in 44 states as of July 20th. And new this week, the CDC confirmed 2 cases of monkeypox, one in an infant in the D.C. area whose parents were visiting from out of the country, and one in a toddler in California. The 2 cases are not related. The CDC say both cases have links to individuals who come from the community of men who have sex with men. The CDC says both children are doing well and they're receiving antiviral therapy. Now, what is close contact in terms of a child at risk exposure? That could mean you're holding the baby or holding a child, hugging or kissing a baby or a child, feeding them, as well as sharing items such as towels, bedding, cups, and eating utensils. So a brief clinical reminder: the time from exposure to symptoms is called the incubation period. For monkeypox, that's 5 to 21 days. People with monkeypox feel sick. They can have high fever, chills, exhaustion, painful muscle aches and pains, and swollen lymph nodes. Then come the sores, which can be intensely painful and can last 2 to 4 weeks. The sores can be on the skin, in the mouth, the genitals, and in the anus. And they're contagious until they're all fully crusted over. You know, monkeypox is not always a mild disease. Complications can include blindness from an infection in the eye, brain disease, encephalitis, dehydration from mouth sores and pain with swallowing, and blood infection if the bacteria secondarily invade those broken skin sores. Now, it's sad to say, but most physicians in the United States have never seen a case of monkeypox prior to this outbreak, and many doctors' offices will not be equipped to do the testing. So if you have a suspicious and unusual rash and you engage in high-risk sexual activities, you may want to go to your nearest hospital emergency room, or you may want to go to a clinic that specializes in treating gay, bisexual, queer men, or trans women. If you're in that high-risk sexual group, you should phone ahead to let them know that you're coming because of infection control purposes. Now, there is one approved treatment that is oral. It's called TPOXX, but this drug is hard to come by because it's in the CDC's expanded access investigational new drug program. So it's only available to people with severe monkeypox. Now remember that monkeypox virus is very hardy. It can stay contagious on environmental surfaces anywhere from 2 weeks to months. So you have to disinfect it with a special EPA approved disinfection, and the people who are doing the disinfection should wear masks and gloves. You also want to wash your laundry after you've handled infectious items. So folks, we've got to increase the word. We've got to increase the awareness, get the word out. Having monkeypox is nothing to be ashamed of. Most cases can be managed at home with supportive care. High-risk people should get the monkeypox vaccine as soon as possible. I know it's in short supply, but if you've had contact with somebody who has it, you should be bumped up to the priority list. Contact your local health department for the monkeypox vaccine, or a sexual health clinic or hospital emergency room to see if they have it. So that's my message today. I know it's a little long. I hope it's been helpful. Take care and be safe.